we'll be talking about our upcoming elections and upcoming town meeting and how we can do this safely for the community. I've also had discussions with our state representative, Ken Gordon, who has updated me on legislation around our town elections and around our town meeting. And hopefully we can come to some resolution and assure everybody, as we will, that they will be safe. Are there any other subcommittee reports or anybody who would like to note something? Sarah, you may want to mute your telephone. Mute your.
My phone is muted.
You are muted. Okay, you are muted because we have a picture of you and nobody else, which is fine. Which brings us to applications. 40 Locust Street, keeping of animals, 6 chickens, and our director, Susan Luminella, will present the request.
Yes, good evening. So the Rabazis are here for the to get a permit for the keeping of 6 chickens. They've been in conversation with Samantha Hardy, our associate health inspector, about the location of their coop and their required plans. They've submitted everything that is required, and Samantha has not done an inspection, but will be doing an inspection either hopefully in the upcoming months this summer. I don't think that they have the coop up yet anyways, and they can talk a little bit more about that. But she saw no reason not to approve this permit.
Very much, Susan, and thank you, Mr. and Mrs. Rabazi. Tell me what you're going to do. Give us a quick summary of what you're planning and why you want chickens. We always ask that question. We don't want to go afoul. Why do we ask that question? Why do you want 6 chickens?
So it's what one of my neighbors actually has chickens, and over the past couple of months that I've been home, I've been able to observe them. I've never been home during the daytime before, but really started thinking about it and doing some research and deciding that, to have a sustainable way to produce eggs and to feed family and friends and also raise the chickens would be something that would be fun.
Thank you very much. Thank you very much. Susan, do we have any reports from abutters?
No.
No complaints or no input whatsoever. Thank you very much.
I actually talked to all of them before I even put in the application, just to test it with them, because I didn't want to go down a road and have them be upset. I've lived here for over 20 years and really know them well, so it felt like it was a better thing to do to talk to them ahead of time, and they were all supportive.
Thank you very much. Thank you. Do I have a motion so we can add and start a discussion? Do I have a motion?
Yes, Mr. Chairman, I'll make a motion to approve the application for 40 Locust Street, keeping of animals, 6 chickens.
I will second.
Do I have a second?
I'll second.
I have a second. I have a motion by Mr. McSweeney and second by Dr. Saltzman. Any discussion? Does anybody have any questions for the Rabazis?
Well, Mr. Chair, I don't have any problem with this whatsoever. I did want to point out, especially given this magical year of 2020. I think the Rabazis have a daughter who is graduating this year, and yep. So Julia, I believe, and I think she was at Fordham or it was Fordham. So I wanted to wish her and you congratulations on her graduation. I know it's a little bit anticlimactic with this pandemic, but I just wanted to give a shout out to her.
Oh, thank you so much, Dr. Saltzman. Is Emma graduating this year as well?
Yeah, she is. She is. Yeah. Thank you.
Yep.
Congratulations. Congratulations for you. It's as much congratulations to you as it is for her. I'm a
the tuition
parent,
bill's
and I
no
know.
more.
I have a motion and I have a second. If there's no other discussion, I'm going to ask for a vote. All in favor to grant the keeping of animals permit. Uh, David McSweeney,
Aye.
Libby Wallenjevich,
Aye.
Dr. Wayne Salzman,
Aye.
and I vote aye. Mr. and Mrs. Rabazi, thank you so much for getting on. Please enjoy your chickens.
Thank you.
Will you get anything formally approved? Susan, will you be sending them anything?
Yes, we'll be sending them a permit in the mail.
Very
Thank
good.
you.
Thank you.
Very
Did we
good.
notify you when we put the coop up because we didn't get it because we weren't sure we'd get approval?
Yeah, that'd be great if you could let us know and then hopefully be able to come out and do an inspection. And then you'll see us again next year. We'll give you a call. So we usually do a yearly inspection.
Okay,
Perfect.
excellent.
Thank you.
Thank you.
Have
Be
fun.
well, be safe,
Yeah, be
and
safe.
enjoy.
Thank you so
too.
much.
Be
Take care.
safe.
Bye-bye.
Bye.
I'd like to please a motion to bring the staff reports before discussion so we can spend as long as we'd like on the discussion of COVID-19 response and updates. Could I please have a motion to move the staff reports
So
to
moved.
now?
So
Second.
moved.
Second.
And I have a motion by Libby and second by David. All in favor? David,
Aye.
Libby,
Aye.
Wayne,
Aye.
and aye, which brings us to staff reports now. Environmental engineer. Christine, do you want to, would you please highlight?
Sure. Before I get started, I wanted to just note that Sarah had added in the chat section that she tried to record, but it's not allowing her to record, and that Don has noted that it's not streaming on Facebook either. So I don't know if there's anything that can be done about that. I just wanted to let
It
you
just
know.
started on Facebook. I just got notification. So
Okay.
I'm checking the messages.
Great.
Thank you.
So
Uh,
for my report, I just mostly worked on COVID-19 related matters. I made a lot of phone calls regarding the Department of Labor and standard cease and desist orders to various businesses that were operating or partially operating that shouldn't have been because they're non-essential services. I had a number of employee questions and or complaints about being asked to return to work. I was able to provide those employees with some information and a phone number for the Attorney General's Fair Labor Division. And then in turn, I was able to speak with the employer about what they were going to be doing for those employees returning to work in terms of social distancing and making sure that their workspaces were conducive to allow the employees to social distance. Many of them were, several of them were limiting the number of employees on site at any time. Other measures were separating desks and workspaces and, one-way hallways and a whole variety of social distancing practices that were put into place. The other main thing I did over the past couple of weeks is I did an inspection of almost all the grocery stores in town and both CVS locations. Those were, and in most cases, prompted by customer comments or complaints regarding practices at those businesses for social distancing. I found that all were working very hard at social distancing efforts with including measures like one-way aisles and tape or signage on the floor that showed people 6 feet from the cash register, closing every other cash register, putting up plexiglass at the cashier stations. Store employees were wearing masks. Stores were counting the number of employees going in and coming out so they could maintain their 3% capacity. So all in all, I think, they are all doing a good effort.
Are there any questions for our environmental engineer? None at all. I just have, no, I do not have any. The only question I repeatedly get is, we're gonna have household hazardous waste day in the fall. I get those questions all the time, and I tell them, God willing is what I say. That's all I can.
I've asked the same question a couple of times, and that's my response as well. We don't know yet. We'll just have to wait and see what the fall looks like.
And then the second question is just a comment. Is we did have helicopter spraying because people have told me they heard the choppers, and we did have helicopter spraying. Is that correct?
Yes, I believe it was last week or the week before.
The mosquitoes are not going to take a break.
Nope.
Nope. Last call. Any other questions?
Yeah, one quick
If
question,
not,
actually. I'm sorry. Christine, I just saw in the report on Dartmouth Road, General Walker Estates, and I know that's been brought up a couple of times recently. Is that all set? Is there a major drainage change there that we need to talk about, or?
So what happened was, after the houses were built at 3 and 5 Dartmouth, they increased the grade of the backyards of those two houses, and when the final inspections were being done, that was noted. There was also an issue with finding the outfall of the underground infiltration system. So the planning board, with input from other department, the planning department and other departments, decided that they wanted to have a third-party review of the design to make sure that it was installed as designed and that it would function as designed, given the additional soil placed in those backyards. And so the engineer for the project, for the General Walker Estates project, had made some recommendations. I don't have it in front of me, but there was an additional small infiltrator unit added at 3 Dartmouth, and there were some swales and curbing added to contain the flow and the direction of the flow. And then the third party did a review, visited the site, and agreed. The third party engineer agreed that those changes would accomplish what was needed.
Okay. And have we heard from any of the abutters? Is there any concerns that we need to address, or is everybody satisfied?
Personally, no, not recently, but I think the planning department is maintaining near constant contact with the abutters to make sure that they're aware of what's going on.
Okay. So yeah, at this point, you don't feel like they need to come back in front of the board at all?
No, not really. There
Yeah.
were just minor changes to
Okay.
accommodate a little bit, extra flow.
Thank you. I'm good. Thank you, Mr. Chair.
Do I have no other questions? I have a motion to approve the environmental engineer's report.
So moved.
Second.
Dr. Saltzman, second by, who is that, please? Is that you, David?
It is. Yes.
Yes.
That wasn't a yoke. Oh, that was the last. That was the last agenda item. Anyway, David McSweeney.
It was Libby.
It was Libby.
Thanks.
So who seconded it, please?
No, I seconded. David.
I
David
second.
did, yeah.
All right. David, all in favor, David?
Aye.
Libby?
Aye.
Wayne?
Hi.
And I say aye too. 4-0. Which brings us Director of Public Health, and she is representing not only herself, but also Christine Pollock, our supervisory nurse, Marlene Johnson, our health agent, and Samantha Hardy, the associate health inspector, who have all submitted reports. So if there are any questions on any of the reports, I will ask for that. But first, Susan, do you have any summary for the 4 reports?
Yes, I just wanted to provide the board with an update on the contact tracing and what's going on with that now. So we've transitioned or begun a transition to utilizing the CTC, the Contact Tracing Collaborative with Partners in Health. And there's a system in place now, and some of our cases are moving up to them for investigation and for notifying the contacts of cases. So we are keeping track now of which ones are with the CTC and which ones we are keeping. Certain ones we are keeping because it makes more sense to keep them with us because we're currently investigating contact to a case that has then become a case, or because the CTC will not take the case for whatever reason. So, for example, they're not taking cases in assisted livings. So we're working. We have a contact at the CTC, and we're working with them. So we have downsized utilizing our MRC nurses. So right now we're only utilizing 2 of the MRC nurses to help out with the contact tracing and follow-up. And we are currently in communication with the CTC about the cases. So it's going well, and I'm hoping that we're able to, I know we will be able to kind of create, hopefully in the next few weeks, a constant communication with the CTC. Right now, there is a little bit of glitches between the software that CTC is using and the DPH software. So we're not always able to see how the cases are going immediately. So that's why we're in email contact with the CTC. So I think it is going well. And even though we still have a lot of cases, it has now become more manageable for us. So that's the update on the contact trace. Any questions on that?
That's great.
That's great.
I'm glad they're
Does
here.
anybody? You broke up, Libby, please.
Oh, I just said, I'm glad they're there for the support, and it's, relieving some of the pressure on the department.
Thank you. Yeah. Again, I can't say enough about our volunteers and the Medical Reserve Corps who have done so much for this community and for the Board of Health. Are there any questions for any of the other 3 reports?
I have one, Mr. Chair, if you don't mind.
Please, David.
Susan, I noticed that there's a handful of restaurants that are selling grocery items, which I think is awesome. It's a great idea and probably good for added business during this time for them. What does that entail? Is it just a simple application? Is there an approval or a decline? What's that whole process like? Hey, Lisa.
Yeah, so we made an effort to expedite that process. So we have a simple application form on our website, and they just email it to us. Marlene takes a look at it and has a discussion with them, and then approves we'll give the approval. I think right now we might have not too many, 3, 4 or so like that. I think we got another one this week. But
is there any limitation on what they can and can't sell, or is it?
Well, Marlene goes over with them the requirements to make sure that they're able to sell everything that they want to sell. So on the application, they need to tell us what it is that they want to sell. So based on what they want to sell, she makes sure that they have the capacity to do that.
That's great. Thank you.
I just want to point out in our supervisory nurse, she is still doing communicable disease and surveillance. I just thought I'd sort of ask the question to make sure everyone realizes that there are other diseases that we're following other than just COVID-19, whether that be tuberculosis or that be Lyme disease or that be Shiga toxin from Shigella. We still have to follow all of those. So none of these diseases take a holiday, and the Board of Health continues to work and to follow those also. Are there any other questions? If not, I will ask for a motion to approve the Director of Public Health's report.
So moved.
Second.
Dr. Salzman moved, and
Second.
Libby Walenchevich second. All in favor, David,
Aye.
Libby,
Aye.
Wayne,
Aye.
and I'm I 4-0. Thank you very much. Which brings us to what everybody's waiting for, and what I find so interesting is the COVID-19 response and updates, and that's under discussion. Why don't we start this time with Dr. Wayne Salzman, who I noted earlier has done 7 updates on BCAT. I know that he has some things to say, and maybe it'd be good thing for him to start this. Dr. Salzman.
Sure. Thanks, Dr. Weiner. I'm happy to. You and Director Luminello had asked me, and I believe it was 8 weeks ago, because I think my first BCAT update was March 20th, Friday, March 20th. So it's actually been eight weeks. Asked me to help support the Board of Health in reaching out to the community, and I was happy to do so. Jen Dodge, Robert Paris have been extremely helpful in my being able to do my 5-minute segment. I'm not sure, as I've told the chair, I don't know if it's brought value to the community, but it's just one more way the Board of Health is trying to reach out to the community. And as I start every segment, I endeavor to inform, support, and help our community be prepared during the COVID-19 pandemic. You know, Dr. Weiner, Dr. Anthony Fauci was interviewed today by the Senate, and he said, he's in a very straightforward way. He said, you know, I'm a scientist, I'm a physician, and I'm a public health official, and my comments all stem from that. So I can say I'm a scientist. I can say I'm a physician. I am an elected member of the board of health, so I'm involved in public health. I'm nowhere near Dr. Fauci in stature, but everything that I say comes from information that I read and things that I think will be useful to the community. So that being said, I do not have anything magical, any magical source when I give numbers and I start my reports. I utilize the Massachusetts Department of Public Health COVID-19 dashboard, which is available to everyone at www.mass.gov/doc/COVID-19. I also make use of the Wall Street Journal website. They do have some free information that you do not need a subscription for. And some of those are the COVID-19 United States numbers, which I think are very helpful as well. So the data that I draw upon is the data that anyone can draw upon. That being said, you know, while there are, as I reported on Friday, while there are some good things happening in our state, we are flattening the curve. It is looking like next Monday will be a time in which the governor will be able to start considering his plan for reopening. We're still having somewhere between 18 and 22,000 new cases of COVID-19 a day across this country, 9.3 million tests, which sounds like a lot, but it's not really that much considering the population of the United States. You know, we've done somewhere over 400,000 tests in the state of Massachusetts, but we have 7 million people in our state. So that's less than 7% of our population has been tested. It's interesting when you bring in those numbers. And so when you think that sadly 5,000 people have died from COVID-19, you have to wonder if we're missing a large number of folks. And as I had mentioned last Friday during my report, as a geriatrician, I'm of course passionate and very concerned about our older adults who have taken on the brunt of this, especially in long-term care facilities. 60% still of the deaths in Massachusetts have been in older adults in long-term care. So this is it's very real to us. Um, you know, the Board of Health, Dr. Weiner, myself, we are working with the town to help that balance between economics and healthcare. I am very concerned just from what I see, what I interpret in my experience in taking care of patients, that we are not at the end of this. I'm very glad that we have flattened the curve, that it is no longer as big an impact on our healthcare system that it had been in the past. But I do believe that what has become norms for us with regard to how we interact with each other outside of our homes is going to be a norm for quite some time. So more than happy to entertain a conversation about what is the safest thing to do, especially as we think about our significant businesses in the town of Burlington. The Board of Health has always been very fair in looking not only at the community but the businesses that reside there, and I definitely appreciate the frustrations with regard to our businesses. But COVID-19 is very concerning, and modeling shows that if we do not maintain some sort of mitigation strategy to suppress the COVID-19 in our population, as we move forward, then come August and September, we could have a resurgence. And while none of us know the details, we see the news. China, South Korea, Singapore are all having resurgences because folks just went back to nightclubs and bars, etc. Wuhan is going to be testing all 11 million inhabitants again because of the small resurgence that has occurred. And I got to tell you, I was very concerned when I saw the pictures from a Colorado eatery and how social distancing was not maintained, nor were masks, and it was tough. Board of Health can't enforce folks to wear masks, but it's come down as a mandate now from our government, and I think it's a very important thing. Vaccination. Dr. Anthony Fauci said that if there were considerations that there was a vaccine by this fall, that he called that a bridge too far. While there are 8 different vaccines currently under construction, and actually whether they will work or not, each vaccine is being mass produced just in case. We're still looking at possibly end of fall, early winter before any possible vaccine could be brought into our area. You know, people ask me about the schools all the time. I have to go along, I will contribute as much as I can as a member of the Board of Health, along with our director and Dr. Weiner. Dr. Eric Conti is also very much in this and is looking at appropriate interventions and what may need to be done. I can't say anything about the fall, but we'll see how things play out. We are discussing things more. For regard to medical treatments, there's a bunch of things being studied now. Nothing is a slam dunk, as I said, or at least now from clinical studies. As I said in my Friday report, vitamin D was touted as the next thing to do as far as over-the-counter medications, and I asked people not to go out to the stores and start buying vitamin D. While we know that vitamin D does have some microbial or virus, bacteria type effects, nobody knows what it does with COVID-19. It is being studied, interestingly, But there's really no evidence that it's something that is going to help at this time, along with all the other over-the-counter products that have been discussed. So at the end of the day, as I say on my Friday updates, what can we do? And we can do what has become the norm for us, and to continue that, because it's crucial. Hand washing, hand washing, hand washing. Cleaning surfaces that are commonly used on a regular basis with household disinfectants. Cover our coughs and our sneezes when we go out in public. Wear a mask. And social distancing is crucial. But it's I talk about being good citizens, and we all heard about the report from the Cape about good citizenship, and I just think the town of Burlington is a wonderful, wonderful town with folks that I call my friends and my colleagues, and I know that Burlington will be able to carry out the utmost in good citizenship here. We're on this together, Dr. Weiner. As I wish everybody stay safe and be well.
Thank you so much, as always. I appreciate, and I know so many others who appreciate your updates every Friday and look forward to them. Thank you very much for all that you're doing and everyone else on this board is doing. And everybody is doing their part. Susan, is there anything else you'd like to say? I'd like you to just please, in doing that, mention the fact that we may or we may not have masks. Where are we if people within the community need a mask?
So right now we have volunteers who are making masks for the community. We have a list of people who have requested masks, and we've been getting them out to them on an average of 2 to 3 days. We're telling people, depending on how fast they can make the masks and depending on how many requests they get, it should be about a week when they get a mask. We're providing 2 masks per address, and we are delivering them to people's mailboxes. So right now, our volunteers have made hundreds of masks. I think, at least, and I haven't done the count, but at least 300 to 400 masks has gone out to residents of Burlington. So, and they're still working away. And any resident who wants to donate, we've been accepting those as well. So we got some donations from residents who have said they've made these masks and they'd like to get them dispersed to the community, and we are doing that for them as well. So it's been pretty successful. People are very grateful to get them, and we just ask that if they want one, they can email us, but email us only if they really do need them, because we're trying to get them out to people who don't have them or can't get them right away. So that is working out well. One other thing I wanted to mention, I wondered if Dr. Saltzman could talk a little bit about the antibody testing, because we are still getting a lot of questions about that. I think there's a lot of misunderstanding about whether or not people should get it. Dr. Catherine Brown, the state epidemiologist, has talked about this on our calls and has said that the antibody testing, although it has a use in studies, may not be so reliable for an individual getting tested. So I wonder if Dr. Saltzman can comment on that. I know you did last week, but again, because we're still getting a lot of questions about it.
No, sure, thanks. So, there's 2 types of testing, and this is what I discussed last week. There is the type that sees if you currently have the virus, and there is the type that comments on whether or not you had the virus. So the type of testing that we talk about all day long is this type of genetic testing, where we can actually grow the genetic information for the virus. And that's when they talk about viral loads, et cetera. Not to go into details, but that's the testing that we've done over 6% of the country, to see if people actually have the virus. So the antibody testing is to see if people had the virus. Did the immune response, was it an immune response generated that you can measure? And so the problem with this is really that, one, the tests, there's a whole bunch of tests out there, and they really need to be absolutely sensitive and absolutely specific, for the numbers of folks that we have tested for the virus, in relation, and they're not. So there is no information currently that the antibody tests are going to give us any great information as of right now, that's going to make things safer, or help us feel more comfortable with regard to, to COVID-19, about returning to work or things like that. There's no information yet that says that this is the way, that we need to proceed. So I know that people are looking for something tangible, something that they can wrap their arms around. And sure, blood tests, we get those done all the time, and we get results from them, and decisions are made around our health based on them. The antibody tests that we have for COVID-19 are not those tests right now. So they are not of a benefit to us as of right now.
Thank you so much. Susan, you still on? Anything else?
Just that we are looking towards the governor's report that is coming out on Monday, the 18th. And once we get the information from that report, we will start to work with businesses and local organizations and the town itself about reopening. So we're expecting that to be the next ramping up that we're going to have to do once we get that report out.
Thank you very much. I'd like to ask the other board members if they have anything that they'd like to offer or would like to comment on. Vice Chair David McSweeney, is there anything you'd like to add tonight?
No, I just not really, and I don't want to sound redundant because every meeting, I praise the board, and I praise the staff, and it's not unfounded or half-hearted at all. I sincerely think that that the staff and the board members behind the scenes are doing a phenomenal job. But I don't know, Susan, if you could maybe think about or talk about, as we start to move from a at home quarantine environment to businesses reopening, how does that change for you and your staff? And are we prepared for it? Are we expecting a change in workflow? Like, have you thought through that based upon what I know it's brand new, but what the governor, as little as he said, came out with yesterday?
Yes.
And sorry to put you on the spot. So you can, but I just think and I know you have thought about it. Or I wouldn't have put you on the spot. But I just am curious, and I think it'd be good for folks to understand how we are planning for when we start to go back to work and start reopening businesses.
Yes. So we've already started having conversations at the town level about how we're going to enforce what could be in the governor's orders and how we're going to work with businesses to make sure that they're in compliance. So, for example, one thing that we started looking at was the mall. Like, what is that going to look like when you're only going to be able to allow so many people in the mall? But then also about the individual stores in the mall. So each individual store, and we don't know, again, this is speculation because we don't know exactly what's going to be in the governor's report, but we're just trying to envision the type of planning that may need to be done. So in the individual stores in the mall, we'll need to know what the occupancy is of each store so that we can make sure that if the governor says you can only have 40% occupancy or 50% occupancy or whatever it is, that they are adhering to that. So we're starting to look at things like that so that we can try to plan for what may be coming out. Another example might be in food service establishments. If the governor comes out and says, well, we're only going to allow outdoor space, and I don't know if this is what he's going to say or not. I have no idea. But say we're speculating on if they may do that. Okay, well, what's going to happen? Our food service establishment's going to want to expand expand their outdoor space. And so Marlene now is looking at, okay, can it be put on lawns, or what type of areas can they put an outdoor space on? And so she's looking at the food code and things like that. So we're trying to anticipate things that could be coming, and then trying to find solutions around that, and how we're going to work with businesses and how we're going to work within the town, because we've already done it within the town. So we're imagining when we come back to work, everybody's going to have to be 6 feet apart. So I've gone to every office of the town with John Sanchez, the facilities director, and we've looked at people's individual spaces to make sure that everybody's going to be adequately spaced apart, which is the 6-foot distancing. So we're starting to look at those types of things, although we can't finalize anything until we get the governor's report back, because we really don't know what's going to be in it.
Thank you very much.
Yeah, that's great. Thank you.
Libby, many people don't realize that Ms. Libby Wallenjevich is a master's degree nurse, and she was an instructor and professor at nursing school, and we're very lucky to have her. Any comments tonight, Libby?
Well, there's very little I can add to what everyone else has said. Short of saying that I think there are an awful lot of unknowns, that we still don't know what is going to happen, how it's going to come down, what is going to be happening going forward. I mean, we have a lot of basic knowledge about the transmission of disease, but this virus is like nothing we've really ever seen before. And I think the town of Burlington is being very proactive. I think they're doing an excellent job at getting information out and planning for whatever can be planned for with the knowledge that we have at this point. And I feel very confident that that the Board of Health is going to be able to roll with whatever information comes out from the governor when it comes out. And it's just going to be a while before we get back to any semblance of normal, like normal we used to know. So thank you to everybody.
Thank you for your comments. I guess I'm last, and I just want to point out a couple of things and a couple of questions I continually to be asked, and that is, do we have enough Burlington Board of Health staff? Can we do what we need to do? And I can tell you we've done it so far. We do have 236 plus food establishments in this community. We've got a plethora of office space, including many international and national headquarters of big companies. We're getting more biotech into this community. We're doing a lot of redevelopment. There's a lot going on in Burlington. We're going to have to be innovative. We're going to have to be patient, and we're going to have to continuously plan. So I can't answer the question. Right now, we've been doing it all. We've been doing it all with volunteers, the Burlington Volunteer Reserve Corps. We've been doing it with employees from other departments who have volunteered to help us. But the buck stops here. And I never thought I would be verbalizing this in my last 32 years, but we've all been very busy. We've all been answering questions. I have urged our team and our board, who has answered the call about long-term planning, And that's what it's all about. And we will do what we need to do, and we'll ask the town what we need to ask them to make sure that we can keep everybody safe in this community. And with that, feel free to take a look at our website on the Board of Health. Has terrific references. Feel free to call me or any member of the board, or call the board office. It looks like that we will have some people in the office in the coming weeks. And everybody, please be safe. And I thank you for everything and your patience. And with that, good night, everybody. I need a motion to adjourn, please.
So moved.
Do I have a
Second.
second? I have a motion, a second. All in favor? David McSweeney?
Aye.
Libby?
It's not allowed.
Libby?
Aye.
Wayne?
Aye.
I say aye. And again, please do what you need to do and wash your hands, what we have been saying now for years. Good night, everybody.
Good
Be
night.
well.
Good night.